Good day, everyone. Welcome to this special interview session in celebration of World Arthritis Day 2025. According to the WHO, over 350 million people are affected by arthritis, and thus a need to raise awareness on this very debilitating condition. With me to discuss this are two powerful pharmacists. I have with me pharmacist Kayode Ogungbemi. Pharmacist Kayode, you are welcome to the show. I also have with me pharmacist Bola Tito Akinsomi. Pharmacist Bola Tito, you are welcome to the show.
Thank you so much for having me.
Alright, so let's dive into the discussion. Pharmacist Kayode, what is arthritis? I want you to explain it to our listeners in layman terms.
Arthritis involves inflammation and damage to the joint, causing joint pain and joint stiffness and reduced mobility.
So I'm still with you, Mrs. So are there various types of arthritis?
Yeah, we have so many types of arthritis. In the record, we have over 100 types of arthritis, and we have three common types in our world today. We have osteoarthritis, we have rheumatoid arthritis, we have gout arthritis. We also have some that are not so common. There are some that is found in children. We call it juvenile arthritis. We have psoriatic arthritis. There are so many of them that are not even mentioned.
Wow. Thank you so much, Pharmacist. Pharmacist Bola Tito, what are the common symptoms of arthritis, and what are also the predisposing factors that can make someone to eventually come down with arthritis?
Thank you so much, Olamide. So, on the arthritis symptoms, one of the most common symptoms that people come up with is pain around the joints, inflammation, swelling around the joints. Another point is that there's reduced range of motion. For most of them to even walk a mile, it becomes very difficult without pain. They start having pain while walking. So, and there's fatigue too. They feel very tired, unusual tiredness, and there is this morning stiffness. When they wake up in the morning, they feel that stiffness around the joint area, and it lasts longer than 30 minutes. So those are the symptoms experienced by people who are having arthritis. And on the risk factor, I think age is the first one. For people who are above 50 years of age, they come down with arthritis. Another risk factor is hereditary. It runs in some people's family. If it happens to your uncle, maybe your parents, there is every tendency that it happens to you too. So let's watch out. Another one is obesity. Obesity, when your BMI, body mass index, is above 30, so there's every tendency that the person come up with arthritis. So there's need to actually check your weight, maintain healthy weight, okay, so as not to come up with arthritis.
If I may just interject it, so that our listeners can have a full view and understanding. When talking about obesity, in layman terms, can you explain so that people listening, whether market women, people that are not inclined with the medical world, what does it really mean to be obese?
To be obese is a calculation, a medical calculation whereby your weight is measured against your height. So for weight is measured against the height. So it's let's say someone is 70 kg, is over the height. Let's say your height is 1.5 meters, so we just weigh the height and we place the weight 75 kg over 1.5 square. So that comes up with the BMI. And if it's more than 30, there is every tendency that the person is obese, and it predisposes you to a lot of disease, not only arthritis but other diseases including cardiovascular disease.
Wow.
Thank you.
Wow, thank you so much, Pharmacist Bola Tito. Pharmacist Kayode, this year's theme talks about, I think the theme says, don't delay, connect today. What do you have to say to us about the theme of this year and the need to be diagnosed early enough and also to seek help?
don't delay.
Yeah, connect today. That's the thing for
It simply
2025.
means you have started, for instance, the patient who have this kind of condition. You must come to see the healthcare practitioner as early as possible so that they can quickly check, run some tests if possible, some symptoms, clinical symptoms, some tests, medical laboratory tests that can ascertain the type of arthritis that you have, and then treatment should start immediately so that it will not cause irreparable damage to the joints.
Thank you so much, Mrs. Carol. I'm still with you, Mrs. Carol. I know there are myths and misconceptions around arthritis. You know, some people feel, oh, because of body weight is not just like Masibola Dito said earlier. I am not overweight, I am not obese, so I cannot have arthritis. How do we demystify this? Is it only a condition for those that have higher weight? And also, how does our diet and our lifestyle also predisposes us to this condition?
Thank you for that. Such a question. People who are obese, they are not the only one in this kind of condition. There are so many people, there are so many things that cause such a condition. So if you are the type that eat anyhow, don't eat food that have omega-3. Omega-3 oil is very good in lubricating the joints. If you are the type that eat anyhow, you are for months you don't even eat any food that contains such nutrients. Definitely you might be disposed to this. And exercise. If you are the type that you are not engaging yourself in regular exercise, you just sit in one place, you eat, no exercise, you have reduced motion, you can easily be exposed to this. And age again, age is also a factor that affects people. As we are advanced in age, there is tendency of all these cartilaginous materials, that's cartilage, at the joint region becoming weak. But this can actually increase as a result of weight. The weakness can be as a result of weight, as a result of you not eating well, and the disease condition too. There are so many disease conditions that can also predispose us to this kind of conditions. So we must check our lifestyle. There should be at least lifestyle modification towards this. And if you discover that this kind of condition runs in the family, you must take your health very, very serious.
Thank you so much. This is enlightening. Let me come to this. As a community pharmacist, I want you to elucidate on the roles of community pharmacists in helping patients with arthritis. I would also like you to expatiate on the needs. Pharmacists talked about omega-3 and more, and we all know how our diet is. Many of us, we don't take diets that are rich in this very helpful substance. So I want you to elucidate on the role of the pharmacist in management of arthritis and also on the need for supplementation if needed.
Thank you so much. That's a great question. Pharmacists are essential partner in management of arthritis, and we are involved in counseling patients concerning pain, medicine, anti-inflammatory drugs, and even disease modifying treatments. We also help to educate patients, like he said, like Famka rightly said, we educate patients on the kind of diet that they should have all the time. For example, I know that avocado contain antioxidants, it contains polyphenol, and these food are very rich in omega-3 fatty acid, and they are very good for people who have the tendency to come up with arthritis. And also we help adherence to patients. You know, for some people you give them tablets, you give them drugs, and they don't really keep to it. Sometimes they even get bothered and burdened about the drug. So we give emotional support to patients that are having arthritis. Thank you.
Wow, thank you so very much. That is very enlightening for us. Francis Kayode, I would like you to quickly share your thoughts as regarding people that probably had an accident in the past, and because of that history of accident, they are having recurrent pains. What are the things that people could do at home that are non-pharmacologic, that could help them manage their condition pending the time that they will meet with an healthcare provider?
Thank you for that. There are so many things that can be done to that. As you have right said, eat food that contains omega-3, and again, regular exercise, but not to stress the joints.
Not vigorous exercise.
Not vigorous exercise, but you can at least. It's not that you should keep on standing for a longer time. You mount pressure on the cartilage, so the condition will get worse when we do that. But that does not mean that you should not exercise. And again, there are so many things that can be also used. You can also use a knee guard. Knee guard, you can use it to just at least support it will reduce your weight on the joint. So from that you can get relief. But what is mostly important there is you must, irrespective of the type that you perceive, you must make sure that your healthcare provider is able to tell you the time and commence the treatment as soon as possible.
Thank you so much, Francis. So as we wrap up, Francis Bolatito, I would like you to advise both the healthcare practitioners and listeners, the patients, our elderlies in particular, our mamas at the market and all, and even students as well, as regarding this year's theme, World Arthritis Day, and how they can take care of their health as it relates to joint pains and arthritis generally.
Thank you so much, sir. Let me say that, please, if you are experiencing one or two of the symptoms that we have highlighted earlier, please connect to the support group. That's very important. Don't suffer in silence. Seek help. Communicate with your professional so that they can help you. Especially if maybe you have been placed on those pain management drugs and you're having some symptoms. So it's very important that you speak up. Don't die in silence. Speak out so that it can be helped. Thank you so much.
Thank you so much, Professor Kayode. Your last word to our listeners, both the professionals, healthcare professionals, and our listeners that are not healthcare professionals. Your last word for them.
Take good care of yourself. Eat well. Do regular exercise. And if you observe any abnormality, any pains in your leg, make sure that you consult when you see healthcare for quick diagnosis.
Thank you so very much. Pharmacist Kayode, thank you for joining us on this session. Pharmacist Bolatito Akisomi, it is a pleasure to have you on board today. So to our listeners, do note that arthritis may be common, but with the right knowledge and care and support, it does not have to steal your quality of life. On this World Arthritis Day year 2025, we encourage you seek help with your arthritis pain that you are having, and we look forward to seeing you at our next episode. Before then, make sure you are living a healthy life. Thank you and bye for now.